our sim moms. Come on in. Two of our sim moms. Now our sim moms are very unique. They're the first of their kind that are able to deliver a baby completely on their own. Before, they had the instructor up top trying to deliver the baby, which for the student who's coming in, they're reading all these things in the literature, then they come to simulation, then you have your instructor pushing out a baby. Kind of weird, kind of awkward. But she was built a couple of years ago. Now they have a lot more different models that are out that are able to deliver a baby on their own as well. But she has a really fancy kind of like accordion or hydraulic system built into her that pumps out the baby. And we're able to do a lot of different scenarios. So breeching, normal birth. We could also do shoulder dystocia. So that's kind of like the turtling. A really hard effect to make with a hydraulic system. But she is able to create a lot of different scenarios for our students. We're also able to give medication administration if we wanted to as well. So we do have real Alaris PC pumps, again, something that you would see in the hospital, something that the students would see in the hospital with medications, and they're able to actually pull up from a vial if they needed to and push it. Oral is a little bit different because of the way that they're designed internally. So in some cases they do have to walk through the steps, so giving oral medication or even sometimes temperature is really hard to take, so we kind of have to improvise on that a little bit. But we do definitely take simulation very important. We want our students to where students have never held a baby before. So we have babies that are designed to be weighted as if it was a newborn baby. So go ahead and you can pass the baby around.
It feels like
What is the weight of that baby? What is the weight of that one?
I'm newbie. Newbie's always really fun. So all of our patient simulators are very unique. It just depends, again, what the design is, what their goals are for their objectives for that curriculum or that course. But babies are able to do a lot of different things. So we're able to see chest rises. We can hear lung sounds, heart sounds. Sim newbie is really well known for the cyanosis and the umbilical pulse. Does anybody know what cyanosis is? See a couple head shakes. Sean?
oh, it's like a blue.
Yeah, so lack of oxygen, typically around the mouth or the fingers or the toes. Huge step in for the nurses to say there's something going on, this baby needs oxygen. Y'all can come a little bit closer and y'all can feel the chest. You can actually feel the pulse as well from the umbilical, so you can put your little finger there or you can touch the chest as well. So go ahead. Sim newbie is also able to do a couple of different vocals.
That's weird.
We have a couple of GTAs, which are our graduate teaching assistants, and they let us know all the time. They're like, man, I wish I had this in my education when I got into school, because sometimes you don't get that in the design or the curriculum. Some universities don't have sim centers, so this is a really great opportunity for our nurses students to get comfortable with and to practice different skills, to go through different scenarios. Sometimes you don't see that taken advantage of. So. What we have on the legs are injection pads, so there are some cases where we're not able to put a needle into the body of the patient simulator. That's not the way that they're designed, but that doesn't mean that we took that skill away. So we do have different equipment, so they would be able to take the needle and inject any kind of medication that they would be giving to the baby for whatever scenario that is. Yeah. His hands are moving right now, so he's in motion, but there's a way to just stop it if I wanted to, or to make motion quicker. So he's able to do a lot of different things and provide a lot of different opportunities for our students. He's mostly used for our pediatric and our OB course, so we'll see him throughout those. All right, let's move on to our next room. Does anybody have any questions so far? Anything in this room or?
When you bring them in, so do they say you have a different scenario with each patient going on? Do they know what the scenario is before they come in, or do you just bring them in?
This is one of our unique rooms. This is our team training room. So basically there's one bay, so that's one space for a patient to lay in, and then there's a lot of space back here. So sometimes we'll have a patient here, and we'll kind of have small classroom seating back here with tables or chairs. Oftentimes we'll use it for our critical care group. This is our essential here. He is able to do a lot of different things. He's one of our highest fidelities. highest fidelities, meaning what he's able to physically, physiology, able to do what we're able to do. So talking, blinking, chest rises. You can feel pulses from head to toe. You can hear heart sounds, lung sounds, bowel sounds. They're very versatile. We can change them from male to female. We can put wigs on, we can put glasses on, we can put breasts on, we can change out the genitalia. You name it, probably could do it. So if y'all want to come around, y'all can actually, feel the different chest, different pulses as well, to kind of give you an idea of what it's like. In all of our rooms, we have functional head wall, so we're actually able to pump out oxygen. All of our outlets work. We're able to do a code blue if we wanted to. We have a phone in our control room that responds to the code blues that are being pushed in the room, so what room it's coming from, how long it's been on. We can actually answer the phone if we wanted to and communicate in the room. We have a patient monitor that's going right now, so we're able to see the different vital signs that's with this patient. In the control room where he's being controlled at, we can actually make the different modifications. So right now he's at 90 heart rate, but if faculty was like, let's go ahead and change it to 110, I can click on it, change it, and it'll do it instantly. That's not a very common thing to happen. We do run scenario as well. The software is really smart, so if we wanted to run a scenario and we're waiting for nursing intervention, so the student applied oxygen or the student gave medication, we're able to do like a cause and effect. Cause the student do this, the effect is this over time, so it's not instant. So after 5 minutes, the wheezing will go away because they provided oxygen for the patient. And those are called trends and handles that are designed into the scenarios. We can design them as well. We have a faculty member that says, none of the things that I'm finding online are working, let's just go ahead and start from scratch. We can design it through the software as well. So we can give the patient identity, we can give them a picture, we can put in whatever vital signs we want, and pretty much create a big master web of what's going to happen. Like I mentioned, our Alaris PC pumps, you'll see them all throughout the Smart Hospital. They are fully functional. We can connect them into the IV sites. Students can physically give medication via IV. We can hang different solutions. We're trying to be more resourceful. Healthcare, if anybody knows, is very, very expensive. And we run exactly the same as a hospital. We have real equipment. These are real beds. These are real patient monitors, real PC pumps. So keeping up with that can be kind of challenging. So we have to be a little bit more resourceful on ours. So sometimes you'll see like hanging clips of different medications that we've added to the solution, if you will. Behind y'all right here, there's a crash cart. That crash cart is fully functional. We have 2 of them. Again, the patient simulators are really intelligent, so we are able to hook the patient up to the defibrillator, pump rolls through, and the patient's able to recognize that and do whatever needs to be next. So it's really cool. We can do different heart rhythms, we can do different SpO2 values, and again, you name it, we can do it. We have different supply pyxuses in our room. We have different medication pyxuses. Typical things that you would see in the hospital, we're trying to make it as relative to what they would see when they do go to the hospital, what they're reading in the literature, and what they see when they come here as well. So 3G is our highest fidelity, and he has the ability to read what medication the student is putting in and at what rate. So it could tell if the student went too fast, went too slow, what the medication was, med errors happen. He has a lot of unique features that you won't see on some of the essentials. He's the one that's able to also sweat at the forehead. He has tear ducts. He has the ability to foam at the mouth as well. So you'll see a lot more of that activity in the tour video whenever y'all get to that point. So this is our control room. This is kind of like the behind the scenes action, if you will. What you see on the laptop is what's going to be running the patient simulator. What you see with the servers is our audio visual. So we're able to, like Marsha mentioned, record anything or see the students that are in the room, talk to them as well. So you'll see headphones, you'll see microphones, and that is our way of communicating with the students. This is what the software looks like. So like I mentioned, I can click on this. I could just input the value here and it'll instantly change. So you'll see it change in the room as well. Not very, again, realistic, but if we needed to, we could. If we wanted to do a scenario, we could do that as well. It just depends. This is a really unique piece especially for our essentials in our 3G. This is a CPR reader, so it's actually able to tell the students how deep they're going or the lack thereof, or where the hand placement is on the sternum as well. So too far up, too far down, too far left, too far right. And then it also will create a history. So we're not doing TPR right now, but basically what you would see is a wave pattern trend of different colors. So green doing good, yellow, moderate, red, bad. And it would just be going up and down across. So we use that mostly for our med surg and our critical care courses, but it's very critical for their curriculum. So they do need to have that tool in order to meet their objectives and their goals. They also have different vocals here. The default sounds are pretty basic, so yes, no, they can scream, they can vomit, they can like cough, but we can also bring people in-house and do different recordings with them and then place it into the program, and then the program will be able to read it. And so now we have more options and more standardized vocals versus what the default settings are.
Programmed to demonstrate the signs and symptoms of real patient conditions, including breathing abnormalities, heart attacks, childbirth, and traumatic injury. Laerdal mannequins Sim Baby, Sim Newbie, Sim Junior, Sim Man, Sim Mom, and Sim Man 3G display chest rise with each breath, have pulses that can be felt, and show signs of low oxygen levels by turning blue. Sim Mom can simulate the birthing process, including delivery of a baby. To augment the learning experience in a labor and delivery room, a monitor displays the baby's heart rate during labor. The Sim Newbie mannequin can represent a full-term newborn just after birth, as well as a baby during the first few weeks of life. Treatments, such as placing a tube down the throat to support breathing, attaching a ventilator, providing chest compressions, and shocking with a defibrillation unit, can be practiced on these mannequins.
Miss Hayes, how do you feel now?
I feel a little better now.
Great.
The infant, child, and adult simulators can make audible sounds such as crying or screaming, and even speak.
Are you feeling any pain today, Mrs. Jones?
Adding another element of realism to the simulation experience. SimMan 3G can blink his eyes, sweat, have tears, and even demonstrate tremors that might be seen during a seizure. Smart Hospital's patients include mannequins that are used for students to practice basic nursing skills, such as dressing wounds, bathing patients, giving injections, placing nasogastric tubes, and inserting catheters into the bladder. Students also learn how to give feedings to infants and children using special tubes inserted in the stomach. Over 100 task trainers ranging from IV insertion arms and hands to infant spinal taps provide students with the opportunity to individually practice specific skill. Holes. SimMan can simulate the tearing and foaming of the mouth response that might occur with exposure to bioterrorist attacks, as well as a pulsating artery from an amputated leg wound. Every semester, mannequins and Smart Hospital staff are used in a community disaster drill as part of the undergraduate community health nursing course.